Hi, I'm Eli Anastasiades, and I'm a research associate at the Eating and Appearance Research Laboratory at Neapolis University Paphos in Cyprus. Today I'm presenting some research that we carried out with Dr. Marios Argyridis, Dr. Marilena Moussilidou, and Dr. Andrew Christodoulou on body image, media influences, and situational dysphoria in individuals with visible physical disabilities. Now, according to the World Health Organization, there are over 1 billion people worldwide who have disabilities. That's approximately 15% of the world's population, or 1 in 7 people. The World Health Organization has actually declared disability as a global public health issue and has stated that people with disabilities are among the world's most discriminated people. Physical disabilities are actually the most common type of disability, and our study looks specifically at individuals with visible physical disabilities, so those which affect physical functioning or restrict mobility, and which are actually noticeable and observable by others. Now, individuals with visible physical disabilities are affected by a variety of issues, such as differences in appearance, so loss of limb or muscle tone, body functionality issues, so for example, difficulties with mobility, sexual dysfunction, and incontinence, and they often require the use of mobility aids. Now, as a result, individuals with visible physical disabilities often face significant challenges with regard to their body image, self-esteem, and social functioning. As many of you probably already know, our society is dominated by ideal body images that are portrayed by the media, telling us how to look and how to be. Individuals with visible physical disabilities have to deal with these pressures, but they don't only have to deal with these pressures, they also have to deal with the added pressure of discrimination and stigmatization that surrounds their disability. And they're often viewed as helpless, dependent, incompetent, and unattractive. Now, qualitative studies are emerging at the moment which show that this does in fact lead to feelings of body dissatisfaction and dysphoric emotions. And what ends up happening is these individuals adopt various impression management strategies in order to try to deal with these emotions and to manage their self-presentation. For example, they might conceal their body parts or completely avoid social situations. Despite this, individuals with visible physical disabilities are still largely underrepresented in the literature. Studies have shown that rehabilitation programs overlook body image, and that healthcare professionals lack the knowledge and the confidence to even approach the subject, which ends up in them treating the body like an object. Researchers have called specifically for quantitative research in order to inform screening procedures and the development of much needed healthcare rehabilitation programs. The purpose of our study was to quantitatively investigate 3 main questions. The first one is, to what extent do body image, media influences, and self-esteem play a role in the situational body image dysphoria experienced by individuals with visible physical disabilities? Second, do these factors differ for men and for women? And finally, are age, levels of inhibition to daily functioning due to disability, and perception of negative attitudes of others towards the individual themselves associated with situational body image dysphoria? Our study employed a descriptive cross-sectional design. We issued self-report questionnaires to 154 men and women over the age of 18 with visible physical disabilities in Greece. They were distributed by 22 physical disability and special needs associations throughout Greece. Our sample ranged in age from 18 to 80 years, and the number of years with a disability ranged from 0 to 65 years. 51% of our sample were men and 49% were women. 35% of our sample had paraplegia, 20% monoplegia, 18% quadriplegia, 10% a spinal cord injury, 8% hemiplegia, 4% an amputation of some sort, and 5% another non-specified visible physical disability. 3% of our sample were underweight, 38% had normal weight, 38% were overweight, and 21% were obese. We also asked our participants about their perceived degree of inhibition to their daily functioning due to their disability. And 13% of our sample reported a small degree of inhibition, 35% a medium, 33% serious, and 19% severe. The measures we employed included a demographic questionnaire, the Rosenberg Self-Esteem Scale, the Situational Inventory of Body Image Dysphoria short form, the Sociocultural Attitudes Towards Appearance Questionnaire, the third version, and 3 subscales from the Multidimensional Body Self-Relations Questionnaire appearance scales. So we used appearance evaluation, appearance orientation, and overweight preoccupation. Now, concerning the results, in order to investigate whether or not body image, media influences, or self-esteem contribute to situational dysphoria, we carried out a stepwise multiple regression analysis, and we actually identified 4 predictors that accounted for 57.8% of the variance. Satisfaction with appearance predicted 34.4%, followed by pressures from the media at 14.4%, internalization of the thin ideal at 4.7%, and finally weight-related anxiety at 4.3%. Next, we used independent sample t-tests to compare the variables of interest for men and for women, and we found that women had significantly higher levels of weight-related anxiety, investment in their appearance, internalization of the thin ideal, pressures from the media, perception of the media as a good source of information, and situational body image dysphoria. And finally, we used Pearson's product moment correlation with a Bonferroni adjustment on all the variables of interest. And we found that the higher the level of perceived inhibition to daily functioning due to the disability, the lower the satisfaction with appearance and the lower the global self-esteem. In addition, we found that the more individuals with disabilities perceive others to have negative attitudes towards them, the lower their satisfaction with their appearance, the lower their global self-esteem, and the more likely they are to experience situational body image dysphoria. Now, our findings highlight that body image satisfaction, weight-related anxiety, and internalization of beauty ideals are really important contributors to the situational body image dysphoria experienced by individuals with visible physical disabilities. In addition, our results show that women are more likely to experience body image concerns than men. And our results highlighted the importance of the perceived negative attitude of others towards individuals with visible physical disabilities, as well as the perceived level of inhibition due to the disability when it comes to body image related issues. So overall, our findings really reiterate the negative effects of sociocultural attitudes on body image related difficulties. And they provide some direction for the design and implementation of very much needed intervention and rehabilitation programs in healthcare settings. Our findings have various implications for practice. Firstly, they highlight the importance of a positive social support system so that individuals with visible physical disabilities are less likely to perceive the attitudes of others towards them as negative. Secondly, our results show that by enhancing body functionality, we might actually be able to reduce the effects of body image dysphoria by lessening the perceived degree of inhibition to daily functioning due to the disability. Our results also suggest that empirically tested intervention plans such as the Body Project might be useful for this population. In addition, the constructs identified in the study as significant contributors to situational dysphoria could be used to inform screening procedures for body image-related difficulties. The situational inventory of body image dysphoria could be used to identify specific situations which cause dysphoric emotions and use these to inform intervention plans which are aimed at teaching specific coping skills, such as CBT-based intervention plans. And finally, our results really highlight the need for body image-related issues to those with visible physical disabilities to be emphasized to healthcare professionals. And this could be done through the delivery of seminars and education programs. Our findings really need to be considered in light of various limitations. These include, firstly, the use of self-report measures, which inevitably introduces the risk of bias due to over or underestimation of answers. Second is that some of the body image measures used in our study have not yet been validated for individuals with physical disabilities. Third, the conceptualization of the body image ideal can vary enormously between cultures and populations. And finally, our study was limited to negative body image and appearance-related factors. Therefore, future research might want to focus on the psychometric testing of body image measures for individuals with visible physical disabilities specifically. Other studies might wish to explore attitudes towards individuals with visible physical disabilities and their effects on body image issues across different cultures and look at any similarities and differences there. Other studies might wish to explore positive body image constructs such as body appreciation and body functionality as protective factors for individuals with visible physical disabilities. And finally, studies would do well to assess the efficacy of empirically tested intervention plans such as the Body Project, specifically for individuals with visible physical disabilities. I'd like to thank you all very much for your time. For any further information or if you have any questions, please don't hesitate to contact us on the 2 email addresses displayed on the screen. Thank you.